Hello, good morning, everyone. In behalf of Caritas Philippines
Morning, Bishop.
and in behalf of the Catholic Bishops' Conference of the Philippines, Episcopal Commission on Social Action, Justice, and Peace, I welcome everyone for this conversation that we shall have uh, with our guest from the World Health Organization. I would like to welcome all our social action directors from all over the country. And most especially, we would like to say at this time, thank you very much for the presence and the availability of our invited guests from the World Health Organization. This is one conversation that we were planning for a long time. In fact, since the beginning of our problem with the pandemic, with the hope that we would be able to uh, partner ourselves with the World Health Organization in terms of disseminating informations to all our people with regards to our pandemic. And somehow, together, we would be able to provide some kind of assistance to many of our people who are at this time at a loss because of the pandemic. In many parts of the world, uh, we have seen in the social media that somehow they are already above the bridge with regards to the problem on this pandemic. But here in the Philippines, many of us are still under the bridge because of the uncontrolled spread of the virus, especially here in Mindanao now at this time. And so, this opportunity that we shall have today, our conversation with WHO, hopefully we would be able to join hands in terms of providing assistance and helping in the information and prevention of our problem at this time on the pandemic. The Caritas Philippines is very much willing with all our network to be of to collaborate and to partner with WHO. So again, maraming salamat at pagpalain po tayong laging ng puong may kapal.
Sige po. So I'll be introducing our speakers na this morning. We have Ms. Ava Batayan. She is an emergency consultant for WHO and the focal point for community engagement for WHO Philippines COVID-19 response. She brings experience working in various emergencies around the world, such as the Darfur crisis in Sudan and the Rohingya crisis in Bangladesh. Her emergency work is combined with more than 15 years of working in community-based development, working for various NGOs in 10 countries worldwide. Also, we have Dr. Nico Silebio. Ralph Nico Silebio is a public health physician at the WHO Philippines Country Office. He is currently a consultant working both as the regional outreach advisor for Visayas and the lead for health service delivery subpillar, where he supports the COVID-19 response in the Visayas regions and provide technical assistance on healthcare pathways to the Department of Health and partners working with health systems strengthening. Prior to joining WHO, Nico has worked for 3 years as a doctor to the barrio and served as the only doctor in the limited resource municipality with at least 30,000 population. He has a master's degree in public management, major in health systems and development. Also, we have June Ryan Orbina from the a communication officer for immunization at WHO Philippines Country Office, where he supports COVID-19 vaccine communications and lead communications and social mobilization initiatives for routine immunization and vaccination campaign. Prior to joining WHO, he worked for 10 years as a molecular biologist and researcher at a public health laboratory. He has master's degree in public health and in science communication. So everybody, on behalf of Caritas Philippines, with our National Director, Bishop Jose Colin Bagaforo, and our Executive Secretary, Father Tony Labiao, and representative to the EXICOM, Father Clifford Baria of Cotabato, would like to welcome the WHO Philippines team to this social action network town hall meeting with the World Health Organization. Ms. Ava?
Thank you, Jing. And thank you, Father Labiao, for the invitation for us to be the resource persons for today's Social Action Network, your town hall meeting. And thank you, Bishop Bagaforo, for the welcome and the message. I'll be touching on some of your message later on. Very, very useful po yung introduction ninyo. I'll be sharing my screen. Okay, so ang hashtag po natin sa session natin today is hashtag faith and action. And this is an online learning session for COVID-19 prevention in communities. But because we have a lot of religious leaders in the room, bishops, priests, we will also be focusing on some practical recommendations on what we could also be doing in addition to what the church is already currently doing. So the learning objectives will focus on these three. How can COVID-19 be prevented? And like I said, the practical recommendations to keep members and the community safe. What to do if someone falls ill. So we have doctors in the room to discuss more about this, and what you need to know about COVID-19 vaccines. So to start the session, if I would like to ask you to, if you have a smartphone or if you're using your laptop or desktop, could you please type in www.menti.com, enter the code 99617239 so that we could do a very, very quick exercise just to measure our learning experience during this session. You can also otherwise scan the QR code that you can see in front of you on the screen. Okay, so again, on menti.com, use the code 99617239. And can you please give us your answer? There's no right or wrong answer here. This is just a self-check. On a scale of 0 to 9, how confident are you with your knowledge of COVID-19 prevention? This is in general. Okay. I know we have more than 40 people in the room, so I hope we can get more than just the 2 answers that we have at the moment. If you cannot answer dito po sa menti.com, pwede rin po kayo sa chat box, and then our colleagues will help put together the answers later on. Ayan, thank you. Maganda po yung may mga sumasagot na. Okay, let's leave it a few more seconds for others to join in. I can see that others are joining and answering on the chat box. Thank you very much. Our virtual online learning session is not just about us giving you a session. We would really like this to be interactive so that we know how we could pace ourselves during the session, and so that we could also make sure that this is an engaging session more than anything. Ayan, thank you po. Maraming sumasagot. Online and offline. I understand from Jing and my conversation earlier, sabi niya, meron din po sa mga churches or social action networks ang naka-screen, naka-big screen. So, pwede nyo rin pong isulat sa papel yan. Tapos, magsa-self-check po tayo after ng session. Okay. So, let's keep this going for another few seconds. I'll see how many more answered. Okay, sa chat room. Good. Okay, that's good. Now, next, staying on the same one, let's ask another question. Ito naman po, on a scale of 0 to 9, how confident are you with your knowledge of COVID-19 vaccines in general? Kasi lahat po, kung doon po sa mga nakasagot ng aming pre-learning session survey, marami pong nagtanong tungkol sa vaccines ng COVID-19. So bigyan niyo po kami ng ideya kung ano po yung level ng confidence ninyo para alam din po ng kasamahan ko mamaya kung paano niya aatakihin yung delivery ng session. Okay, thank you. Yan, mas marami na pong mga sumasagot. Okay, good. Let's keep those answers coming in. This will give us an idea and I'll just go back to my slides. Patuloy pa rin po yan na napapasok yung mga sagot ninyo. Okay? Perfect. So, to start with, thank you for participating and in our self-assessment. So, ito po ang ating, ano po ba ang COVID-19? Alam nyo, marami na po sa atin nakakaalam kung anong ibig sabihin nito. Pero primarily, ang COVID-19 po ay, this is a new coronavirus. This new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. Okay, yung incubation period po nito ay between 2 to 14 days. Ano po bang ibig sabihin ng incubation? Ito yung gaano katagal bago lumabas ang sintomas mula sa araw kung kailan ka na-expose sa taong may COVID-19. Okay, so ito po yung ating mga maaaring tandaan. Gaya ng sinabi ko kanina, kumakalat ang COVID-19 sa pamagitan ng talsik ng laway ng taong may COVID-19. So yung droplets, kaya di po ba lagi nating sinasabi bakit tayo gumagamit ng face mask para po protektahan natin ang ating sarili at yung mga tao sa nakatabi natin. Sa mga matataong lugar kung saan limitado ang physical distancing at walang maayos na daloy ng hangin, ito rin po ay kung mas madali siyang ma-contain at makumalat dito. Pag malapit na nakikipag-usap ka sa kapwa-tao sa saradong lugar, kaya nga po sinasabi natin kahit na nasa opisina tayo or nasa common places, magsuot pa rin ng mask. Hindi po ako nakasuot ng mask ngayon dahil ako lang po ang tao dito sa kwarto na to. Na kumakalat din po ang COVID-19 mula sa gamit na nahahawakan ng may COVID-19. Okay. So, ito po ay importanteng tandaan, yung sinasabi nating 3 C's. Dahil ang 3 C's, dito po mas mataas ang panganib sa mga lugar na ito na kung magkakasabay ang ganitong kondisyon, mataas ang panganib ng pag-transmit ng COVID-19. Ano po ba ang 3 C's? Crowded places, close contact settings, at confined and enclosed spaces. Ibig sabihin, ito yung ating mga iiwasan. At gagawa natin ng mga paraan para ma-prevent natin ng COVID-19. At ito po yung magiging discussion natin. So tandaan po natin ang 3 C's para po sa konteksto ng usapan natin ngayon. Okay, so now we proceed with the practical considerations and recommendations for religious leaders and faith-based communities in the context of COVID-19. And I'd like to take this opportunity to thank the Church, the Catholic Church, all the religious leaders and faith-based organizations who have been taking big efforts and steps in making sure that you're doing a lot of COVID-19 prevention. You're the first in the community to actually respond and do something. So we would like, as WHO, to ensure that we continue to protect the leaders who are at the forefront of the protection efforts and the community people who continue to do a lot of humanitarian aid work in the COVID-19 response. So let's look at gatherings. When it's permitted, pwede po tayong bigyan po natin ng mga emphasis ang mga bagay na ito. Okay, ito pong lahat ng sinasabi namin na mga restrictions or guidance ay base po sa scientific evidence. Kaya sa WHO, ang binibigay namin ay based on technical and scientific data para po mabigyan din po kayo ng basehan bakit ganito. So mag-maintain tayo ng at least 1 meter distance sa mga kausap natin, at least mas malayo, mas maganda, mas protektado. So at the moment din po, we're trying to prevent our usual practice when we go and maybe touch some religious objects in the church. Pwede na pong bawasan yan. Ginagawa na po natin yan, alam po natin. So we also need to encourage healthy hygiene among participants in faith services and frequently clean worship spaces, sites, and buildings. So these are some guidance or recommendations when we're doing some gatherings, when it's permitted, because we know that different parts of the Philippines have different restrictions at the moment. Moving on. So we can conduct faith activities remotely and virtually, which is what we're doing at the moment. Some of the activities that we do are actually transmitted through virtual learning space. So there are two things that we can utilize here: the technology, like what Caritas is actively doing. We see how they're actively engaging the people through the online service. And then you can also use low technology. I wanted to emphasize this photo because, sorry, Jing, I forgot to name the site of this church, but this is a very good example of conducting our faith activities, going to church, going to mass, and avoiding, maalala niyo yung 3 C's kanina, in-avoid talaga yon, yung close contact and close space. Look at this. This is a perfect example, and this is a very good one. People are sat outside, so it's open, and they're using a projector, no? Para patuloy pa rin ang pagsisimba. Kasi importante pa rin ito, no? Lalo na ngayon yung ating pag-practice ng faith. So it's low technology and it's being utilized here. We also support doing safe ceremonies. So, you know, when gatherings are allowed, ano po ang pwede natin gamitin? E di mag-observe tayo ng limits. And we look at the national and local public health authorities na kung paano at ilan ang pwedeng mag-attend. Kung paano naman kung in-person gatherings hindi pwedeng mangyari. E di sabihin po natin, pwede pa rin po through distance, pwedeng live streaming and video technologies. Note that WHO doesn't stop the faith being practiced or the religious practices being done. It's actually suggesting that there are a lot of possibilities that can be done because of the current case. Kasi na-explain natin kanina na kapag close contact tayo or magkakasama tayo sa isang room, mataas ang transmission. So we can do activities by taking out those yung mga factors na yon. Kung ang health authorities naman ay nag-i-issue ng guidance limiting in-person funeral prayers, for example, pwede naman po nating gawan to ng paraan, magpe-pray tayo in absentia. So marami po tayong pwedeng gawin, and I'm sure these are already something that you're all doing, but some ideas for others also to consider or to note. Isa pong factor or isa pa pong mga nangyayari ngayon, paano po naman natin gagawin ang safe burial practices? So we're encouraging the faith leaders to help the grieving families to ensure that their departed loved ones receive respectful, appropriate funerals and burial rites. Tapos, we have to make sure to know how to safely plan and perform such funeral rites that's protecting the mourners and showing respect sa mga taong namatayan. So consider all these safe burial practices. Ito po napaka-importante, ang usaping mental health and resilience. And if you look at this slide to the right, it's actually showing how the community got together during this crisis because maraming nawalan ng trabaho, walang livelihood. So, ang malaking impact nito, nakita natin kung how people started more and more getting depressed, or the mental health has been badly affected. So as a community, let's enhance helping others, helping the community get together so that we can manage the worries, no? And one example is what this photo is showing, how people got together so that they could help the others. Kahit konti lang, but it's a form of helping each other during this crisis. So there's a lot of things that we could do, prevent and respond to situations of domestic violence as well. You can offer special prayers for the sick alongside messages of hope and comfort. Okay. Punta naman tayo sa ano po yung role ng mga priests and mga bishops natin, mga religious leaders. This again, as I mentioned earlier, a lot of these things are already being done, but we continue to communicate it because it's very, very important in preventing the spread of COVID-19 transmission. Importante po. So, nasa slides po nakikita natin dyan. Ang isa sa karagdagan maliban sa pag-wear natin ng face mask, yung pag-cover po ng cough and sneeze, or having a handkerchief or tissue around you always para meron kayong pangtakip. And for those who want to go to church, please consider staying at home na lang po. We highly recommend it to stay at home if you're feeling unwell. In addition, faith leaders could communicate the following: avoid the 3 C's: crowded, close contact, confined places, and mass gatherings. Avoid touching surfaces. Stay informed and follow advice given by your healthcare provider, the national and local public health authorities, and stay informed about risk. Now, we want to focus here about the risk of the older people and people with underlying medical conditions. Kasi po, sila yung pinakamataas ang risk for getting the severe yung magiging impact sa kanila. Kung kaya lagi nating sinasabing, protektahan ang ating vulnerable population, ang ating elderly, at saka yung may mga medical conditions. So, that will be discussed even more later sa ating mga susunod na topics. Ito pa po, ano pa po yung pwede nating i-communicate? Importante po sa ngayon ay mag-encourage tayo ng acceptance of vaccines. We always pray this with the prayer that we started earlier kay Jing. Sabi niya, no, isa sa nakalagay doon, we thank you, ito yung prayer kanina ha, we thank you for the vaccines developed. So our role as church leaders is to also encourage acceptance of vaccines when available sa mga communities natin, no? And especially for the elderly. Gaya ng nabanggit kanina, ang elderly ang isa sa pinaka-prone or may high risk na makakuha nito, kaya kailangan po nating pagsabihan or i-share yung message na i-accept po yung vaccines pag available na sa ating mga LGUs. I will save this link, but this photo is in Salisbury in the UK. They turned their church into a mass vaccination center. Tapos nilagyan pa nila ng beautiful music on the background habang nagba-vaccine ng mga elderly. So this is a very good example of how church is the faith and action is happening. Ito naman po, how to communicate health protection information. Maraming paraan, ginagawa na natin yan, but let's use the different platforms, web pages, newsletter, publication, streaming services. I know Caritas is big on this. You also have social media technologies. And ang pinaka-importante sa ating mga bishops and priests who are here, and thank you for sharing this, but if we could weave the messages into our sermons and prayers so that the communities will hear us. You know how much we respect priests in our communities. What you tell us, talagang dinadamdam po namin yan, and we take it into action. So Here are some recommendations for community measures, which is one of the roles of our faith leaders in COVID-19 prevention. If you don't have this yet, you may want to look at establishing facilities for hand hygiene. We can put marks on the floor. We can put temporary barriers to separate attendees. I've seen photos of this shared from churches in Baguio. And install or make available temperature scanners and do temperature checks. We also can do schedule of services para hindi po sabay-sabay, so we can have alternative, and especially you limit the number of attendees. Ito po pinaka-importante or isa sa mga importanteng bagay, you improve the ventilation in places of worship. And do this in addition to limiting numbers and physical distancing. Furthermore, we love singing in church and we do this as a practice, but it would be good if we do it in well-ventilated spaces with face masks and face shields. Face shields because we're in the Philippines, so this is something that's required by the national government. So we do this during rehearsals and the actual service. Alternatively, we can do outdoor singing, even better. For contact tracing, let's practice registration of participants. There's a very good example in Baguio, and I forgot the church, but they provide you with numbers. And when you have a number at the entrance of the church, you then go and sit on the chair, on the pew where that number is assigned to you, para very efficient yung contact tracing. We also emphasize the need for people with symptoms to stay away from practices and celebrations and stay at home. Nakikita natin na madaming nangyayaring mga transmission ngayon sa mga funerals, sa mga weddings, mga ganyan. So, ito yung mga iiwasan natin. Ano? And then, finally, if we could consider, like the example we mentioned earlier, or we showed earlier, consider the use of church and church premises as potential vaccine sites. This is another thing that we are recommending the faith leaders to uphold human rights. And you do this, you're very good at this, and address stigma and discrimination. Very important po yung attention and inclusion of vulnerable populations. So we need to protect the elderly, for example, and make sure that the things on the list on the slides are practiced and done. Okay, so these are some key takeaways from the session that I've just shared you. Ito po yung wrap up niya. I'll just read it in case some people are not able to see the slides. But if we could share evidence-based information about COVID-19. Number 2, ensure safe-based gatherings. And then strengthen mental and spiritual health, well-being, and resilience through individual contact and through social and other communications media. Number 4, ensure that a human rights-based approach to advocacy, messaging, and service delivery is systematically upheld. We would also like to see promotion of interfaith collaboration and peaceful coexistence during this pandemic. Ito maganda for, especially with all the social media information happening around, it's also our role to ensure that accurate information is shared within communities. And we have the role to counter and address misinformation. To do this, the easy way is to look at what the Department of Health is saying. So, sabi natin, di ba, evidence-based ang information natin, or look at the facts from the WHO website and other reliable medical information websites. And finally, if we could advocate the acceptance of vaccines, this is already in our prayer, but we continue to tell this. And I'm sure the church has creative ways of saying this to the people. Why we're always emphasizing about this is one of the things that we do is do surveillance on how vaccines is being accepted and how vaccines is being done in terms of the priorities. No? Kailangan pa rin po natin na mas marami pa po sa A2 yung priority, yung ating, i-discuss po yan ni June mamaya, Pero yung elders natin, mas kailangan nating merong maraming mag-register at magpa-vaccine. And finally, ito po yung ating key messages just to wrap up. Faith-based organizations have an important role to play to work with health and development agencies to identify mechanisms to increase access to information and services for all people, especially vulnerable communities. Accept COVID-19 vaccines when available. And very, very important, continue with proven preventative measures such as wearing masks, cleaning hands with alcohol-based or regularly washing our hands, physically distancing, and avoiding the 3 C's. So you don't just do one, but a combination of all. A combination of all protects you effectively from getting the virus. So with that, I'm going to hand you over to my colleague, Dr. Nico, to talk about his topic on what to do when someone falls ill. Over to you, Doc Nico.
Yeah, so thank you for that, Eva. And just to begin my presentation, as church leaders, we also need, and we regularly provide advice to our constituents. And one of the major things that always being asked is, what will we do when we fall ill, kung magkasakit tayo, and we will be discussing that on this next presentation. So just a few outline of what we'll be doing. So we will be answering these questions. How to know you are sick, what to do if you're sick, if you need to seek care, if you were a close contact, and how can I contribute, what to do if someone else is sick, and lastly is what to expect. So next. Next. So these are the different symptoms that we usually look for. So how to know if you're sick? So once we have this list of signs and symptoms, so fever or chills, cough, shortness of breath or difficulty of breathing, fatigue, pananakit ng katawan, sakit sa ulo, nawalan tayo ng loss of taste or smell. We have sore throat, runny nose, nausea or vomiting, or diarrhea. So the next thing we usually ask is, ano gagawin ko when I have one of these symptoms, one or two of the symptoms? So next. So what to do if you're sick? So first is go home, and next is consult your local health authority. So the first thing to do, always know, this is for everyone's information, is pag when we feel any kind of symptoms na binanggit natin kanina, it is always crucial that we consult our local authorities for immediate actions as well. And if you are staying with others, important to isolate quickly and continue to take preventive measures na the ones that Eva has emphasized, no? Physical distancing, wearing of masks, hand hygiene, and very important at home is actually ventilation. So next. Other things to consider is we rest and hydrate. We provide symptomatic treatment. So kung nilalagnat tayo, we take paracetamol. And warm lemon honey water for cough or even any cough medications when we have cough. Then we practice our usual general precautionary measures of frequent hand washing. And very importantly, just to for our psychosocial awareness is to stay connected with our loved ones, and your body does the rest. So just a disclosure that we do not encourage home isolation, and that is why very important thing to do is to consult your local health authorities so that they will take action. But in the meantime, while waiting for our local health authorities, these are the different measures that we can do while waiting for the action from our local health authorities. And your body does the rest. Next. So another question is, when do you need to seek care? So these are the warning signs that we have to look out for us to say that kailangan ko palang tumawag at humingi ng tulong because I'm experiencing some of the symptoms. So first is difficulty of breathing or shortness of breath, pain or pressure in the chest, dizziness or confusion, severe muscle pain, fever or cough na hindi nag-improve but it returns and worsens, the loss of speech or mobility, seizures, weakness, and worsening of existing chronic medical conditions. So the next question is, what do I do if kailangan kong mag-seek ng immediate care or for emergency concerns? So next. So the first thing to do is, again, call your local emergency hotline. All of the local government units, because of this pandemic, has actually set up their own local emergency hotlines. And let's coordinate to our community leaders as well for the details of these local emergency hotlines. Another option is to call the One Hospital Command Center. So last year, DOH, together with other agencies, has launched this One Hospital Command Center, which actually provides assistance not just on the referral of patients, but as well as patient navigation as to where our patients or our family members will seek care for an appropriate facility. So for the One Hospital Command Center, you can use if you have a mobile app, you can download the Pure Force and Rescue Corp citizen app, and or you can key in one of these hotlines on the right, so 1555, 02886 500, and the Smart and Globe hotlines for the One Hospital Command Center. So next. So I'll just briefly describe to you, what do we mean by step-up care? So when we say step-up care, this is the care being given for those at a lower facility, and then as what we've explained, na lumala yung symptoms. So from having no symptoms or having mild symptoms, biglang nagka-worsening of symptoms, and categorically, we are being tagged as severe or critical cases of COVID-19. So basically, this is the patient flow and healthcare provider network issued by the Department of Health. So basically, pag wala tayong, when we are only mild case or wala tayong symptoms or what we call asymptomatic, we usually just do our isolation at a temporary monitoring and facility, what we call TTMF, or pwede tayong pumunta ng level 1 and infirmaries. I put some home isolation here with an asterisk because this can only be done if the local government unit permits it, or if may mga chance na pag sobrang dami na ng cases and the healthcare system can no longer provide the facilities, so we use home isolation as a last resort. So if mild and asymptomatic have severe symptoms, we automatically refer these cases to a COVID-19 referral system in level 2 or level 3 hospital. So yun sinasabi natin step-up care. So next. So what happens at a health facility? So once we are being referred from a low level na health facility to a high level because we nag-worsen yung symptoms natin, our healthcare workers are on standby waiting for us to be taken care of. So what happens is we are given the appropriate medications, may it be for fever, for those na nagka worsening conditions, we provide steroids, and we provide oxygen therapy, and we are being monitored regularly by our medical doctors, and our body does the rest. Next. So just very briefly as well, when galing tayo ng COVID-19 referral hospitals, next, Ava. Yes. So pag galing tayo ng COVID-19 referral hospitals or a level 2 or level 3 hospitals, ibig sabihin tayo ay nandun tayo sa severe, critical, or with comorbidities na kaso. So once our condition is already stable enough, we are being discharged and being put into a lower level facility such as our TTMFs, level 1 or inferiors, or sometimes we're being discharged to continue our isolation at home. No? So this is what we call step-down care. So yun lang naman yung pinagkaiba ng step up and step down care. Why do we keep on emphasizing this? Because of our low resources, no, when it comes to our healthcare system. Ibig sabihin, we don't have much beds, no, for everyone. We wanted to maximize the use of our beds, especially in the level 2 and level 3 hospitals. Ibig sabihin, dapat yung mga nandun sa COVID-19 referral hospitals or level 3 hospitals are those really needing the care na kailangan talaga. So dapat yung mga nandun are yung may comorbidities, having severe or critical symptoms. And then once they are stable, we put them on step-down care para na decongest natin, and we give those beds to those needing it the most. So next. So another question na lumalabas, how will you know if you've recovered? So the first thing we have to know is only a healthcare professional can say whether you have recovered or not. No? So you should only discontinue isolation when you have been advised to do so by your health providers. So very important, not just for the information of everyone, is these are the criteria for discharging patients from isolation. Ibig sabihin, discontinuing transmission-based precautions without requiring retesting. So for sa mga taong nagka-symptomas, we are being discharged 10 days after the symptom onset, plus at least 3 days additional days without symptoms. Ibig sabihin, wala tayong fever or any respiratory symptoms. And for those na naging asymptomatic, ibig sabihin sa course ng disease niya, hindi talaga nagka-symptomas, we will be discharged or tag as recovered after 10 days na nag-test tayo ng positive sa SARS-CoV-2. And is only applicable for mild and asymptomatic cases. And very important to know is hindi natin kailangan ng repeat testing just for us to be tagged as recovered. Next, so what's next, no? So after natin we were tagged as recovered, we have to ensure that we still clean our hands frequently. We keep at least 1 meter distance from others. We wear a mask when 1 meter distance from others is not possible. We still avoid crowded public gatherings, and we still ensure a good ventilation, just like everyone else. So next. So next is what to do if you were a close contact. So I'm sure everyone has encountered the word close contact. No? So being a close contact is a person who failed in 2 or more of the following. So being in a poorly ventilated space, hindi nakapag-distansya ng 1 meter, unprotected or ibig sabihin hindi nagmamask, or na-expose sa isang tao who had COVID-19 for more than 15 minutes. So what do we need to do, no? So once we identify ourselves as a close contact to a COVID-19 case, no, we go home and quarantine ourselves. And home quarantine means we stay away from other people just to prevent us from infecting others as well. So these are the things that we need to do: wear our mask, hand hygiene, we hydrate and eat healthy foods, and we monitor ourselves. Next. And these are the things, no, that hindi natin dapat ginagawa. So do not go to work or public spaces, do not catch taxis or buses, or just in short, kailangan natin stay lang at home. Next. So another question is, how long do I need to stay in quarantine? So you should stay in quarantine for 14 days after your last contact with a person who has COVID-19. And we have to follow advice strictly to protect ourselves and as well as our loved ones. For example, noong June 1 was our last contact with a person who has COVID-19. So our last day of quarantine will be June 15. This is considering that we really did not go out or have any exposures and any other exposures from anyone, considering na nag-home quarantine talaga tayo. So next. So next is, ano naman gagawin natin if hindi tayo yung may sakit, but other household members or other church members, no, is sick, no? So first thing is we create a simple household plan for action. So we designate sino yung pwedeng mag-aruga sa may sakit, sino yung bibili ng mga bilihin natin sa bahay. Next is we isolate the sick person, and as much as possible, no, we have a separate bathroom for the sick. And yun nga sinabi natin, have someone healthy care for the sick, no? And always wear our mask. Next. We still continue this now. We wash hands. We don't share personal items with the sick. We clean all high-touch surfaces daily, including our bathroom, pag meron tayong shared bathroom. We keep them hydrated and eating healthy, and we monitor the patient's symptoms. Lastly is we provide them psychosocial support and help them seek emergency medical attention should any of the symptoms that we have provided a while ago happen. Next. So what will we expect, no? Being either someone who is sick or those nag-aaruga sa may sakit, no? Or being a close contact. So frontliners may visit you for contact tracing and testing. So we need to cooperate, no? And disclose any available details na pwede natin maibigay. So they may request you to continue quarantine or isolation. Next, why do I keep on emphasizing this, no? Quarantine and isolation, because these two terms are actually two different things, no? When we say quarantine, it means separation and movement restrictions of people who are exposed to COVID-19. Ibig sabihin, those who were close contacts. And we say, and when we say isolation, no, this is a separation of sick people with a contagious disease such as COVID-19. Therefore, isolation intends to treat and monitor those who were suspected or probable or a COVID-19 case. So we have to be we have to know the difference between quarantine and isolation. In its simplest form, isolation are those for the sick, and quarantine will be the term that we use for those who are exposed or those who are close contacts. So isolation may be done at hotels, isolation facilities, or at home. Or as we again emphasize, we do not encourage home isolation as long as we have available health facilities for isolation. And if we use home isolation as a last resort, if the capacity cannot meet the demand for healthcare services. And we also have other criteria for us to consider mild home isolation, such as the ones below. So pag yung kaso is mild and asymptomatic lang, may separate room or bathroom, there's no elderly or pregnant in the household, and we are able to be monitored by a healthcare worker or a health professional. So lastly, next, we should expect na tayo ay irregular monitor ng ating healthcare workers. So I'll end with my last slide. So may kasabihan tayo, di ba, na ang ating kinabukasan ay nakasalalay sa ating mga kamay, but sa panahon ng pandemic, next, ang ating kinabukasan ay nakasalalay sa ating mga payo at braso. So later on, we'll be discussing as well about vaccination. And actually, I'll end on this and pass this to our colleague, June. Over to you, June.
Yes, thank you very much, Doc Nico, and good morning. And thank you again for inviting WHO in this very important awareness session. And so in this section, we'll talk about vaccination. We'll give you a few key messages to keep in your back pocket para habang nag-uusap kayo sa inyong peers o sa inyong mga the people you serve, you'll be able to communicate these different messages. So next few slides, please. I think we'll skip that slide. Next slide. Yes. So let me start by saying that vaccination is everyone's job. It actually takes the entire society to ensure that we are vaccinated. We have seen this, yung importance nito sa ating routine childhood immunization, yung pagbabakuna ng mga bata natin under 1, wherein napoprotektahan natin yung more than 45 million children around the world every year from deaths which are preventable through vaccines. So we have seen in this immunization program the importance ng vaccines in saving lives and in protecting against diseases. Such that for the vaccination program to be successful, kailangan natin magtulong-tulungan, and we need influencers such as you. We need your trusted voices in the society. We need alternative voices as well na hindi lang nanggagaling sa health sector to say that vaccines are safe and effective, because it's our job for routine immunization to protect our children and to protect our communities. Now we extend this thought in the current situation we're in, where we're in a pandemic and we need to help each other to stay protected and to keep the number of cases low. And vaccination is one of the means to do this. So again, in the same thought, it's also our job. It's also our responsibility in our communities to ensure that there's vaccine confidence at mataas yung uptake ng ating vaccination, because this is one of the ways wherein we can put an end to this pandemic. So the more na navaccinate tayo, the more na nabakunahan ng ating communities, along with the preventive measures na na-mention kanina ng previous speakers, then we are on our way towards closing this pandemic or ending this pandemic, initially bringing the number of cases down. Okay, next please. So we have been talking about vaccines, that they are safe and effective. And in the next few slides, we hope to be able to convince you, such that you'll be able to convince your communities as well that vaccines are safe and effective. As mentioned nga, vaccines have been saving lives globally each year. And here comes an opportunity for COVID-19 vaccines to further save lives and avoid severe illness, hospitalizations, and deaths. Next, please. So vaccines are actually powerful life-saving interventions. These are one of the interventions na masasabi natin in public health na nakakatulong talaga sa pag-provide ng quality of life and ensuring that we live longer and we live the best kind of life that we have. Vaccines are simple, safe, and effective ways of protecting people against harmful diseases. Our routine immunization program, for example, for 40 years, we have been using routine vaccines and adding a few vaccines every now and then whenever they're available. And these vaccines come in many different forms. I will not discuss specifically anong iba't ibang klaseng bakuna, no? But generally, these vaccines use our body's natural defenses to build resistance and make your immune system stronger. Na ibig sabihin, once nabakunahan ka and kung dadating man yung sakit, maaaring hindi lalalala yung sakit or maaaring hindi ka namamatay or ma-hospitalize because you are vaccinated already. And you can see in these photos, no, different vaccines which are being rolled out in the country. On the upper left, you'd see a doctor from one of the hospitals receiving one of the first few shots ng COVID-19 vaccine. So this is for adult immunization. Sa baba naman is a campaign which we recently finished, which is for polio. Because if you know, we've had a polio outbreak and it's about to be closed. So watch out for the announcement ng closure ng polio outbreak na yan. And we immunize our children by giving them polio drops along with injections sa ating routine immunization. But for the campaign, we've been giving polio drops all over the country, and natapos yung campaign na to earlier this year, and we're closing the polio outbreak. So you can see yung importance ng immunization dito in protecting us against different diseases. Next, please. So we'd like to share with you 5 short messages which we hope you can keep in your back pocket, baon-baon ninyo, such that kung may magtatanong, you are equipped with these messages and you somehow know how to navigate your way towards conversations na maging vaccine accepting ang ating mga kausap. In the same way, these messages might be needed by some of you who need to be convinced now that vaccines are indeed safe and effective. So we'll go through these messages one by one. Okay. First is on the safety and efficacy of vaccines. note that there are strict protections in place to ensure the safety of COVID-19 vaccines. Vaccines undergo rigorous testing in clinical trials to prove that they meet internationally agreed standards for safety and efficacy. Kasi kung minsan marami nagtatanong, ano kaya yung COVID-19 vaccines na to? Hindi kaya in-eksperimentohan kami or hindi kaya ito ay isang global plan towards some evil purpose, or hindi kaya safe, hindi ito safe dahil mukhang minadali, in a year nagka-vaccine na tayo agad. So take note that all vaccines, whether these are COVID-19 vaccines or routine vaccines, undergo clinical trials. At yung clinical trials ito nagpo-prove that they are safe and they are effective at may mga global standards na sinusunod ito. For COVID-19 vaccines, medyo napabilis ang proseso natin because there's global cooperation to come up with vaccines very fast kasi may pandemic tayo ngayon. Kailangan may intervention tayo agad. Kaya yung countries na medyo mas madami silang resources, they pulled in their resources, did the clinical trials in parallel, and provided funding such that ma-push yung clinical trials in a quicker pace. Kasi kung minsan in other vaccines, yung funding source, yun kung minsan yung nagpapa-slow down. Kaya medyo magbagal yung vaccine development. But in this case, because of global cooperation, napabilis natin yung development ng vaccines without skipping yung important standards or important steps to establish yung safety and efficacy ng vaccines. So ibig sabihin ng mga bakuna natin sa COVID-19, even though they're new, they've undergone clinical trials and have been studied well for their safety and efficacy. Next, please. And these vaccines are not just validated by international bodies. May mga bakuna tayong under the WHO's emergency use listing. So it has undergone assessment by WHO. And may mga bakuna din which have undergone, aside from the EUL, the processes under the national regulatory authorities, which is the EUAs, the emergency use authorization process na ginagamit din dito sa ating bansa. And this is also another process, another layer na ma-assess yung safety and efficacy ng vaccines. So aside from this, kapag niro-roll out yung mga bakuna, these vaccines are also continuously monitored to confirm that they remain safe for all who receive them. Kaya continuous din namin monitor yung effects ng vaccine. And lahat actually tinitingnan yan. After mo bakunahan, mayroon tayong tinatawag na adverse events following immunization na monitoring. Ibig sabihin nito is lahat ng pwede mong maramdaman after mabakunahan, whether fever man yan or some other illness, whether or not related sa vaccines, these are being monitored. And most naman ng mga AEFIs na ma-classify on the severe side are not due to vaccination but are mostly coincidental. Because vaccines generally have mild side effects, as we'll explain later. Next, please. Second, on vaccine prioritization. So ngayon na medyo dumadami yung parating na vaccines, and within this week, you'll hear in the news of new vaccine arrivals din. Meron tayong tinatawag na vaccine prioritization. And we have to note that COVID-19 vaccines are a critical new tool to protect people, especially the most vulnerable, to save lives and to begin to regain some normalcy. Support the prioritization of health workers, older persons, and those with chronic conditions. We understand that everyone is excited to get vaccinated, or most people are eager or are even impatient to get vaccinated. But we have to note na may mga priority groups tayo, and priority natin yung ating mga health workers, older persons, and those with chronic conditions. Now, kahapon na-announce yung government na nag-open na yung prioritization doon sa tinatawag nating A4, which are the frontline workers, essential workers. So even though nag-open ito sa wider rollout, let's still note that the priority of vaccination are health workers, older persons, and those with comorbidities. So bakit important ito? It's important to note because sila yung group na at highest risk of COVID-19 infections, of COVID-19 na severe na complications, and of COVID-19 hospitalizations and deaths. So nauna, kailangan nating mabakunahan sila because we need to save lives para protect sila. And second, we need to protect them as well para hindi ma-overwhelm ang ating health system. Hindi hindi dadami yung demand for hospital beds, for ICU rooms na makikita natin kung hindi protected ang itong mga high-risk groups. And this is all the more important ngayon na may mga risk tayo ng tinatawag nating variants of concern na medyo mas mataas yung transmission rate. So we need to get them vaccinated as quick as possible, kumbaga unahan natin and be a step ahead of the virus and protect them as much as possible. So if you have peers, if you have friends, family members who belong to these groups, encourage them to get their vaccine doses. Next, please. As I mentioned, ito yung prioritization natin in the country, and this is in alignment with WHO's SAGE, or the Strategic Advisory Group on Immunization, na recommendations and values framework kung paano dapat nagpa-prioritize ng ating different groups for vaccination. So ngayon, the rollout is ongoing for A1, A2, and A3. Kaka-announce ng kahapon na the A4s are being vaccinated in NCR plus 8 other areas. But again, as mentioned previously, let us push for prioritization itong A1, A2, and A3s natin. I believe our priests, our pastors, our other religious leaders are part of the A4 group as A4.10, if I'm not mistaken. There are 13 different subgroups dito sa A4 na ito. Okay, next please. Yung third message naman natin is on vaccine side effects. So remember that the benefits of vaccines outweigh the risks. Even online na ang daming conversations about risks of vaccines, but kailangan natin tingnan yung very little risks ng ating vaccination against the huge and immense risk of not being vaccinated, of the risks of COVID-19, the disease itself. Kasi kung ma-compare natin yung figures dito and even stories of the risks of COVID-19, nagka-COVID sila, and some of them had the severe illness or were even hospitalized. Some even died. And we compare with the minimal risks of vaccination. Usually the risks are common side effects are mild or moderate and would go away within a few days of their own. For me, for example, when I received my first dose of the AstraZeneca vaccine, I had fever. And I also had body pains for a few days and headache for a few days. But I wouldn't risk myself of not being vaccinated because I know na kung hindi ako nabakunahan, what I might feel would be far greater. I might even be hospitalized. And it's not just about being hospitalized, no, yung stress of being away from your family, of being sick, of missing work, also of what might happen to you kung na-hospitalize ka, of the financial burden din of hospitalization. So vaccines save us from all these different concerns. As mentioned, also vaccines are continually monitored to detect rare adverse events, whether or not these were caused by the vaccine. Fourth, marami tayong narinig ng mga variants of concern, variants of interest. Ngayon ay na-rename na lately yung variants to alpha, beta, gamma. Marinig natin mostly ito sa news. But what we have to remember is that the best way to combat new variants is to continue hand washing, physical distancing, mask wearing, and getting vaccinated when it's your turn. So important na ginagawa natin ito lahat, getting vaccinated when it's your turn, and also at the same time following the very measures na nakasanayan na natin. So it's always vaccination along with these different measures. So we'll know also in the next message why we need to do all of these all together. And fifth, yung fifth message natin is on vaccine optimism, that even though COVID-19 vaccines are an important tool, they should not be seen as a silver bullet, as something which solves everything. To end the pandemic, it will continue to be important for everyone, including those who have been vaccinated, to continue practicing other protective behaviors. So why is this so? Baka ang daming nagtatanong na bakit pa may pagpabakuna kung kailangan ko pa rin mag-wear ng mask, kailangan pa rin mag-physical distancing, kung kailangan pa rin dapat nag-avoid ako ng crowds. Ano pang purpose ng pagbabakuna? As mentioned, the purpose of vaccination now is to protect yourself from being hospitalized, having severe illness, and deaths. Still, evidence is being gathered now how much protection yung binibigay ng pagbabakuna against being able to transmit the virus, or how long ang protection ng pagbabakuna, or how or ano yung protection na bibigay ng bakuna against different variants? Ano yung magnitude ng protection na to? So iba't ibang klaseng pag-aaral yung ginagawa pa ngayon and kumakala pa ng evidence for all of these. But for now, what we know is that vaccines protect against what I've mentioned earlier. And it's important that while all these evidence are still being gathered, important na in-observe din natin yung other precautionary measures such as paglilinis ng kamay, pagsuot ng ating mask, pag-avoid ng crowded places, and pag-practice ng physical distancing, and keeping our spaces as well well ventilated, as mentioned din ni Ava earlier sa ating presentation. So it's important that while we are getting eager for vaccination, we're also continuing with our compliance with these different preventive measures. So always magkasama or magkaakibat sila lahat. Next, please. So again, these were 5 messages which we hope that you can keep handy with you as you communicate with your respective communities, with your fellow leaders as well on vaccination. And if you need more information, there are credible sources that you can look at. For example, the WHO website or the World Health Organization website. So maraming other messages and other answers to your frequent questions doon, which you can refer to. We need to take care of what we read online kasi ang dami-daming fake news, ang daming haka-haka, ang daming conspiracy na lumalabas. We always have to confirm these with the credible sources natin online, as mentioned, DOH or WHO or some other health authority. So it's important to be armed with the right information, especially in this pandemic. And as we continue serving our communities, knowing that vaccination is everyone's job, and hopefully in the vaccination against COVID-19, we take on that role as well in encouraging our own communities to get vaccinated such that altogether we are stronger sa pandemic na ito. Back to Ava.
Thank you, June. And as mentioned earlier, for our faith-based leaders and our religious communities, it's great that we continue to be working with health authorities, and as such, it's a good opportunity for us, if we're not doing it yet, to reach out to our city or municipal or our provincial health office or the regional offices of DOH, which we call the Center for Health Development, so the CHDs, para tignan kung paano tayo makapag-cooperate to complement each other yung work natin sa ating mga local communities, because ang diocese natin has a very, very big role to make sure na ang COVID-19 response ay holistic. Ang sabi nga natin sa ating mga nasa simbahan, it's such a big community. And what our priests and our religious leaders say are actually very effective and being followed. So we have the role to be making sure that we're also making these partnerships happening on the ground. We would like to introduce a list of names, and these are our colleagues in the incident management team of COVID-19 response of WHO Philippines. Regional outreach kasi ito yung mga key areas natin sa Philippines, and you may reach out to them per region sa inyong diocese. And today we're actually we have our colleague Dr. Jack Kitong, who's going to join us on the open forum. So I'll hand this over to Jane.
Hello, thank you so much, Ms. Ava, and to everyone, to Dr. Nico and to June for the presentations. Would like to also welcome in Dr. Jacqueline Kitong, MPH, the Technical Officer for Maternal and Child Health, and also the National Professional Officer at WHO Philippines, and also the focal person for regional outreach in Cordillera Administrative Region. So this time we will be opening the floor for the open forum. Although we have already received several of your questions, pero would like to invite everyone, ano po, kung meron kayong mga gustong ipaabot na mga katanungan, kadagdagan po na katanungan aside doon sa mga responses natin sa survey. So, simulan na po natin ito. Ano? Okay. The first question is from our birthday boy, kay Kuya Ava Guardian. Happy birthday, Kuya Ava. Ayan, sige po. So, ang first question po natin is, what would be the best day to take a COVID test if you have a close contact with a COVID positive?
What would be the best date to take a COVID test if you have a close contact with a COVID positive? So, well, I just have to echo as well, no, what Dr. Jackie has said. No? So usually that's 5 to 10 days after the last exposure with a confirmed positive case. However, actually, there are some LGUs no, now working on the contact tracing and management team, no, na yung iba, they, especially for those who are household members, we usually don't, they are usually exposed to a confirmed case kasi a very long period of time, no. But in cases where in a general perspective, the best day to take a COVID test would be like 5 to 10 days after a close contact. So yeah. Dr. Jackie, may dadagdag ka pa ba?
Yeah, it would be the same. However, according to, well, it's also experience. It's best to get it between 7 to the 8 because the result will depend on the viral load that you have. Ibig sabihin, how much of the virus is in your blood or in the specimen, like sa throat swab or the nasal swab. Baka kasi may mangyayari pag masyadong maaga or masyadong late, hindi na ganun karami yung virus na nasa ating ano. So, ang magiging result nun, parang it's false positive, false negative. So, according to many studies, maganda between 7 to 9 days. Yun daw yung pinaka-peak na ano. But I agree with Dr. Nico. Thank you. Over to you, Ava.
Ava, if I may just add, just to add as well, na the management of the close contact really does not depend lang talaga sa testing. What is actually more important is being a close contact, we were able to monitor our symptoms. And pag nagka-symptomas tayo, we disclose this to the healthcare worker who is monitoring us and be able to continue or finish the 14 days quarantine. Kasi the 14 days quarantine is based on the recommendations of having an incubation period of 14 days yung virus natin. So that is the most important part of the management of close contacts. Over.
Okay, thank you. Thank you po sa sagot. Another question is COVID-19 an airborne thing? And is it possible for the virus to be airborne?
I'll take that, and the doctors in the room can also elaborate more. So let's look at the difference between airborne transmission and droplet transmission. Balikan natin yung sinabi ko kanina, ang COVID-19 virus ay natatransmit sa talsiklaway, no? So it's through droplets na share. Kaya 'di ba lagi nating ini-emphasize at bakit tayo nagfi-face mask is because of the droplet transmission na nangyayari. In the case nga lang ng COVID-19, nagkakaroon ng airborne transmission kapag yung ito na high level na sa mga doctors na to, pag inaalagaan nila yung mga pasyente, and I hope the doctors here could share more. Pero pag may mga specific circumstances kung yung mga treatments or nag-generate ng aerosols ay nangyayari, pero sa mga close settings, mga ganyan. Halimbawa yung manual ventilation before ng intubation, mga technical na to. Pero ang importante para sa atin sa communities yung droplets. Kaya palagi po tayong mag-face mask. Kung nagkakandak yung singing natin, di ba? When we sing, we produce yung ating mga meron tayong mga talsik ng laway. That's why we encourage that the singing will be done in well-ventilated places, even outside when it's possible, etc. Doc Nico, would you like to add?
Just an addition to what Eva said now. So she said that the virus can spread now from an infected person through person's mouth or nose in a small liquid particles when the person coughs, nagsisneeze, kumakanta, breathes heavily, or nagsasalita. So these liquids are of different sizes ranging from droplets or what we call aerosols, no, yung mga maliliit. So usually for aerosol transmission would only just occur in certain circumstances such as procedures doon sa mga sa hospital setting, but outside of medical facilities, aerosol transmission can actually occur in specific settings such as indoor, yung mga enclosed spaces, crowded and inadequately ventilated spaces katulad ng restaurants, fitness classes, nightclubs, offices, and even places of worship where infected persons spend very long time periods with others. And there are still high quality researches, no, that is still needed to address many of the acknowledged research gaps related to the routes of transmission of COVID-19 virus. And this it needs to be updated as well in the coming weeks. Over to you.
May I add, Aba?
Go, Doc Jack.
Yes po.
Okay. In relation to the closed space, yung 3Cs natin, the reason why we should avoid that is because basically, yung SARS-CoV virus, which causes COVID-19, is a droplet. Droplet yung transmission niya. But there are circumstances that it gets suspended in the air. Ito yung kulang ang air ventilation because we are so close with each other, or sarado yung ating space where we are, or we are in a crowded space na kulang ng isang metro. Pagka umubo yung may sakit, or while you are singing, like Ava said, in the church, while you're singing, you're talking, tapos sarado yung space, yung virus ng COVID will not drop down immediately. The lack of air will let it get suspended in the air for some time. And that's the time na lilipat sa ibang tao. Lalo na kung wala kang mask. So that's why i-correlate natin lahat ito. That's why you need to have the mask. Okay? And you have to keep 1 meter distance. And there should be a very good air ventilation. Yung air exchange, may sinasabi yung mga engineers natin na mga pare, they would know this. That there's a certain air exchange that you need para maganda yung flow ng air. So yun po, I am relating it with the 3Cs. Ayun po.
Thank you.
It's not an airborne disease. However, these circumstances would make the virus get suspended at a longer time in the air. Hindi siya agad bumabagsak. Okay. Thank you.
Jing, may I just add?
Yes,
especially sa ating mga bishops and priests, because I know when we go to communities and we have our vehicle, please protect yourself and your passengers by rolling down your windows. Para po, kasi ang sasakyan natin kapag naka-aircon tayo ay enclosed space. So create ventilation by opening and rolling down your vehicles. Marami pong nakakakalimot dito, pero let's do that. Let's look at the office. Yung mga nasa diocese ng Dumaguete, I hope that our friends there have the windows open also because we're all gathered in one space. So these are just practical recommendations that we can easily put into practice. Thank you.
Thank you for the reminder, Miss Ava. Kasi akala natin talaga kapag nandun tayo sa loob ng office na tayo-tayo lang, or kapag nandoon tayo sa sasakyan na tayo-tayo lang din, safe na. Pero yeah, it really would pays to be extra careful. From Father June of Ordaneta, environmentalists recommend that we should use washable masks for its environment friendly. Do you have any recommendations about this?
May I?
Yes
Aba?
po, Dr. Jack.
Sige, sige. For yung surgical mask naman is basically recommended for health workers in a health facility and those who are sick na nasa bahay. Although sabi nga ni Dr. Nico, home quarantine, home isolation is the least recommended. As much as possible, you go to a facility. Now, the medical mask, yung hindi po siya washable, they are used for health workers na nasa hospital. I do agree with the washable mask. Yun na yun. For people who are like us, yung siguro kung we are just going to market or in the church, we can use that. Because tayo ngayon, one time I was nadestino ako sa Ilocos area. And while I was walking along the beach, and that was the early part pa ng COVID pandemic, ang dami kong nakita na surgical mask nagkalat doon sa beach. So it's really environment unfriendly. So if you ask me, then, and I think the recommendation is to wear cloth mask. We have to differentiate between a surgical mask, medical mask, and a cloth mask. Yung cloth mask yung pwede nating labhan and then reuse. But make sure that it is well washed. Gamit na, lagyan nyo ng chlorine. May certain dilution ng chlorine that you can use para ibabad mo na yung mga, and also your face shield. Pag gumagamit kayo ng face shield, make sure that pag inalis nyo, you wipe it with alcohol bago nyo ilapag. But it could be a potential source of infection din yan. Thank you. Over to you.
In addition to what Jack said, yung recommendation po, yes, of course, mag-cloth mask tayo. It's more environmental friendly. I'm all for that. Recommendation din po, 3 layers if you're using the cloth mask. So a lot of the masks now will have like something in between, yung pocket na ganyan. Nilalagyan ko po ito ng another layer pag hindi na po siya 3 layers para may extra protection. And I always have hand sanitizer with me na call this alcohol based para po before you put your face mask lagi ko yung naka-sanitize kasi nga 'di ba nagta-touch tayo ng surface palagi. So I hope makatulong po 'yon.
Thank you. From Ateneeds ng Ozame, some political leaders somehow counter what WHO advised on protection and doing information. Example, the wearing of face shield is no longer necessary. So ano po yung comment or advice ninyo tungkol dito?
So that's the advice of the national government. So whatever the national government, the Department of Health is saying, dahil nasa Pilipinas po tayo, yun po ang natin susundin. Imagine, if you remember, you go back to one of my early slides, is follow what the national local health authorities. So we leave it to ito yung advice ng national government. Thank you.
Okay. Thank you. Another question is there is a new evidence from laboratory studies that some immune responses driven by current vaccines could be less effective against some of the new strains. What can you say about this?
Yeah, I can take that. So ang COVID-19 vaccines natin kasi that are currently in development or have been approved are expected to provide at least some protection against new virus variants because these vaccines elicit a broad immune response involving a range of antibodies and cells. So therefore, changes or mutations in the virus should not make vaccines completely ineffective. Okay? So data continues to be collected. and analyze on new variants of the COVID-19 virus. If you remember in one of my early slides, we always talk about scientific evidence, and we base our studies and our comments based on that. So WHO is working, and we continue to work with researchers, health officials, and scientists to understand how these variants affect the virus's behavior, including the impact on the effectiveness of vaccines, if any.
Thank
But,
you.
but in addition, whilst we're learning more, we're in the process of learning more, and I'm sorry to keep saying this, but if you look at my background, we continue to do all this. Washing of hands, physical distancing, wearing a face mask, cough hygiene, and ventilation. Thank you.
Yeah, thank you so much. Yun yung susunod, how not to get COVID. So,
Eto.
nasagot na. How not to
Ano po?
get COVID.
Oo.
Opo, sige. Another question is, after completing the second dose of vaccines, is it safe not to wear mask in public anymore?
Hey, Eva, you want me to answer that?
Yes, Doc.
Sige. So the decision to lift public health and social measures like the mask wearing actually must depend on several contexts. Two of the most important factors to consider when we try to ease our public health measures like the mask wearing is actually how much, number one, how much transmission is happening in the community or in the country. And next is the second one, and the most important one is how wide the vaccine coverage is. So these are the two factors na kailangan nating na ma-answer. So in the area where we are right now, wala na bang transmission nangyayari? And second important factor is gaano na ba kalaki yung coverage natin? So getting vaccinated protects you from serious illness and death. So once vaccinated, you're able to estimate the date of significant impact on your likelihood to infect others or be infected by others. So this is all in the context of local transmission conditions. So let's take, for example, in Australia and New Zealand, even when vaccines were not available, people could take their mask off because wala naman kasing virus na nandun, or there's no longer transmission na nangyayari. So I think I'll stop from there. Over.
Thank you. Another question is, vaccine is the way, is vaccine the way to control COVID-19?
I think the participants are already ready to answer that question, no? So we've given a lot of combinations of how we could do it. So apart from vaccination, we continue to, so ang vaccination ang tulong para hindi tayo maka-experience ng severe impact or hindi tayo ma-hospitalize because of COVID-19. Pero in addition, we continue to do the preventive measures, the minimum public health standards, which are what's already showing here. Hindi ko na uulitin kasi memorize nyo na yan.
Okay, thank you. Another question po is, what are the difference in the COVID variant and how this affect efficiency of vaccines? Pwede din siguro itiretso na Ms. Ava, how long is the effectivity of the vaccine and why assessment on vaccines varies in the course of time?
Sige, I'll answer a part of the question. So on how long is the efficacy of the vaccine? 6 months ba? 1 year? Lifetime? So for now, it's really hard to answer this, no? Kasi we don't know until additional data is collected. So there are a lot of researches being undertaken nowadays, no? And we are collaborating with a lot of experts. But the question is under consideration by a lot of our experts. So clinical trials on these vaccines only began a year ago and roll out across populations even more recently lang, ngayon lang, within this year. So there's therefore a very limited data available on how long the protection from current doses lasts and whether an additional booster, di ba, most likely tatanungin kasi natin, kailangan ko pa ba mag-booster? So would be beneficial or for whom? So I think that's our answer for now. Over.
Thank you. Okay, I think we'll have to have our last two questions. How do you know or how do you determine if a person is asymptomatic? Kasi usually, di ba, pag may symptoms, mabilis lang sasabihan mo, oy, wag na munang pumasok ng opisina or mag-isolate na. Pero kapag asymptomatic, we really won't know. So, paano po ito?
Jing, I'll start, and my colleagues could take over. When you're asymptomatic or when you have symptoms, pareho din lang po ang gagawin natin. When you kasi na-expose ka and maybe you don't know if you have it. So we continue to wear our face mask so that you don't share the virus to others. Then you keep your physical distance because you're doing your everyday thing, diba? Don't let your guard down. Yeah, so that's the key thing. So in fact, some of them they said that you treat yourself like you have the virus para continuous yung protection mo sa sarili mo at sa ibang tao. Ito ang tandaan natin, especially if we live with elderly population. Our communities in the Philippines, we do multi-generational settings at home, no? Some live with our grandparents, some live with our elder parents. So think of it more on how you protect the ones who are vulnerable. Para po, yun yung isipin natin. Mas yun po yung context natin dito so that we continue to protect each other through the minimum public health standards. And Dr. Jackie shared some information on the chat box, and we will be sharing you our slides if you would be interested.
Thank you.
I'll add na lang, Jing. You see, asymptomatic kasi that means, di ba, wala talagang symptoms. And even as medical practitioners would say, no, na declaring symptoms sometimes is actually subjective. So depende yan sa tao. If they sabihin nila na inuubo ako, kumakati yung lalamunan ko, nawala yung panlasa ko, those kind of things are subjective. That's why it is also the responsibility of the person to declare these symptoms. Kung nagkaroon man sila ng fever, ng sipon, ng ubo, pagkawala ng panlasa or pangamoy. Kasi the response for COVID-19 is actually both whole of government and whole of society. So it's not just, I mean, our responders na kailangan lang magambag, but also as individuals, we have a responsibility to disclose any valuable information for the betterment of not just ourselves, but for the whole of the community. So over.
Thank you. Last question from Father Jasper of Puerto Princesa. Ang government ay nagsusulong na magpabakuna ang lahat pero hindi lahat ay gustong magpabakuna. Wala pa bang gamot na po pwede nang parang once and for all pumatay sa virus?
I'll answer that, Aiva. Sige. Apparently, there's none, and there are still a lot of clinical trials now, clinical studies that being undertaken. Now, what we have for now is actually a management on people na nagkaroon na, and what we actually recommend now is the use of of steroids, and that is actually in the condition of having severe and critical, no, and as well as oxygen therapy. And what we still have for now is actually our basic public health measures para for us to be protected from COVID-19. So, syempre ayaw natin doon sa part na nagkaroon tayo. That's why iti-treat natin. Doon pa rin tayo doon sa prevention na for us to get COVID-19. So, over.
Okay, maraming salamat po. Now I'll turn over again the screen to Ava for the surveys that we'll do before we forget everything. Ano po na nakuha natin for this morning's town hall meeting. Miss Ava?
Thank you. So, balik po tayo doon sa, if you still have your menti.com, let's just have a quick check para reviewin natin. Sabi nga natin, ang ating this learning session is really all about not just us giving the information, is also for you to look at how we are now after getting this. And this is a continuing process, hindi lang po dito nagtatapos. Kaya nga maganda yung marami kayong ginagawang activities. So if you could share us your answer, by giving a self-assessment, how confident are you now with your knowledge of COVID-19 prevention? Let's leave a few moments kasi magkakaiba tayo ng pace ng internet. Yung iba din, please answer on the chat box. Tapos yung iba who's sharing one room and na naka-projector ang ating session, thank you very much for organizing that. You can also help us collate your answers. So I'll also look at the chat box whilst people are... Wow, generally now, we're now 8 and 9. Talaga, dahil lang ba nandito kami sa room, kaya... Thank you po. That's really good. It's a really good assessment din po, and I hope that this nakatulong po yung session. Okay, so yun yung pinag-usapan natin, yung COVID-19 prevention. At marami pa po yan, mukhang marami tayong mga assignment na gagawin, no? Kasi I know in some areas I want to share this, no, because this one came out from the survey which we sent prior to this session. Maraming mga ginagawa, mga health webinars, nagdi-distribute ng food bags. So, maraming ginagawang mga tulong din, mga COVID-19 prevention and response. Okay, next question. Stay on your phone, stay on your laptop. Ito naman. On a scale of 0 to 9, paano naman kayo ngayon ka-confident with your knowledge of COVID-19 vaccines in general? I know it was only a very short session for COVID-19 vaccines, but how do you feel now? Sagot ba yung tanong nyo kung magpapavaccine na po ba kayo? We say it in our prayers. So we're thinking that there's COVID-19 vaccine developed. So how do we translate that, no, in our church work or religious work? Okay, so mas marami na ngayon ang nasa 8. Kasi kanina medyo nasa range tayo ng 3, 4, 5, and now we're nasa range ng 8. Very good. Marami pa po tayong patuloy po nating tutukan yung mga usapin tungkol sa COVID-19 vaccine. We do have a Facebook ng WHO Philippines, and actively po kaming nagpo-post dyan ng information. So please feel free to follow us so that you could also look at the recent news about COVID-19 vaccines. And finally, ito po, we would like to know what actions, apart from what you're doing now, that you would like to take forward in your church community to amplify COVID-19 prevention. Ayan. Let's use the remaining time of the hour para mapakinggan naman po ano po kaya in addition to what you're doing now. Some examples, no, of activities. merong mga, this one, International Eucharistic Congress Convention Center and Sacred Heart School is actually a venue for isolation facilities for moderate COVID-19 patients. So kung sino po yung diocese na meron na nandyan, salamat po for using that as an isolation facility. So I wonder kung after looking at practical recommendations today, looking at what Doc Nico discussed and looking at vaccine awareness, ano pa po yung pwede nating gawin that you would like to take forward in your church community, in your diocese to amplify COVID-19 prevention? Okay, more sessions like this. Kayo na po ang pwedeng magbigay ng session na ganito. We can share you our slides, no problem. Virtual Eucharistic celebration, yes. Letting church facilities to be used as COVID facilities, yes, yes. Sharing of volunteers for vaccination, tama po yan. More information dissemination. Okay, so a lot of things to think about, no? So we'll keep this running and okay, training of church workers as COVID speakers. I hope this was one of the opportunities. I know you have plenty of opportunities where you train your church workers, but I hope we were able to help, especially in simplifying the medical language, no? Sometimes people say na usaping medical yan, baka hindi natin maintindihan. But you know, we strive to make sure that the language is also easily understood. Partnership with LGUs, very good on COVID vaccine rollout. Wow, yan, maganda yan. We'd like to follow up on that. Empowerment of the church workers to help in promotion of vaccination. Opo, napakalaki po talaga ang role ng church sa ganito, sa ating response. Okay, so thank you very much. I'll keep this running and sorry, marami pa palang sumasagot sa chat box. We will copy those. Jing, I would like to ask for your help na lang, if you could help us share the results of the chat box later on so that we could also have a copy of that. So I'll hand it over back to you, Jing. I'll keep the slide running. Thank you very much.
Jing, nakamute ka.
Sorry. Okay, thank you so much. While we are all trying to respond to the question, Miss Ava, okay lang ba? I'll share screen. We just excited lang kaming ipakita ito. This is like one of the things na we promised to you and to the WHO team that we'll do our own campaign in wearing a mask. So we'd like, before we all say goodbye to each other for the meantime, for this morning, we'd like to share with you this short videos that we did with our Caritas Philippines staff on why we need to wear a mask. Wait lang. I'll just make sure that I am sharing also the sound. Okay.
I wear a mask because I wear a mask because I wear a mask to protect my special child. I wear a mask because I want to protect myself, my co-workers, and my clients. Nagsusulot ako ng mask para suportahan ang sarong COVID-free na komunidad.
I wear a mask because my child still can.
Magsuot kog mask aron dili ko matakdan ug dili pug ko makatakod sa uban.
Nagsuot ako ng mask para iwas sa virus. I wear a mask because I want to be part of the solution and I care. I wear a mask because I want to protect myself, my family, and others. And Loving is caring.
Nagsulod ako ning mask kay gusto ko na mahunong ang pandemic.
I wear a mask because palangga ko kamo. Matay hao chow yung may kami ang hai kong yi. I wear a mask because it's an act of justice. Nagsuot ko og mask tungod kay mask, mag-alay sa kapwa. Mask, mag-atiman sa katawan.
Nagsuksok ako sang mask para malikawan ang paglabta sang COVID virus.
I wear a mask because I want to live longer and serve more people.
I wear a mask because I care and it works.
I wear a mask because bilang proteksyon sa mga mahal ko sa buhay.
Nagausara ko sang mask hindi lang para sa kaugalingon ko kundi para sa iban.
I wear a mask because prevention is better than cure.
I wear a mask because it's a mask.
Isang paalala mula sa Caritas, Philippines.
Ayan, thank you so much po. Maraming salamat. Naliligayahan lang po kami. Hindi ko maitago yung kaligayahan ko. Nung makita yung video. This is like the first time that we are sharing the video to everybody. Especially sa lahat po ng members ng Social Action Network. So, maligaya po kaming habang ginagawa yun, and we are hoping na maligaya din po kayong napanood ninyo yung video. So, sa mga hindi po nakasali, kapareho ko doon sa video at saka yung iba pa naming staff sa Caritas Philippines, we have another one coming up. So, tayo naman ang bibida doon. Okay, sige po. So maraming salamat sa inyong lahat. On behalf of Father Tony, who's I think in another call, I'd like to call in Father Clifford, who's our representative of the Social Action Network. Would like to call him in for the closing remarks and to thank everybody for being here. Father Clifford. Ano na to? Part na to ng role mo, di ba po? Maraming salamat. Naka-mute kayo, Father. Ayan, okay po.
Okay. Good afternoon to everyone. In behalf of the Caritas Filipinas, as the representative of the Social Action Directors in the Social Action Network, magpasalamat sa inyong pagbabahagi dito sa very important and relevant information na kailangan malaman namin, and at the same time namin sa ground, especially sa mga vulnerable sectors na very doubtful on this particular issue on vaccination. May mga communities kami dito na available na yung mga vaccines, pero takot talaga sila dito sa vaccination dahil ang dami mga fake news na lumalabas sa mga social media na parang nagsiserve as talagang doubtful at takot sila. But then with this information now, I am trying to share this one. Una sa mga kaparian namin ngayon, I took a lot of pictures doon sa presentation kanina, and I started sharing it among our priests because we all know that some of our priests also very afraid about this thing, and pag walang relevant and proper information, ganun nga ang pwedeng mangyari. But this one now, and I know the same thing and the same sentiment siguro sa mga DSACs natin all over the Philippines. Almost we share the same information situation, and now that we have this information coming from a very reliable source, World Health Organization, then we can, as a church, we can truly help our people and to let them know about the real truth and the real thing about this pandemic. So thank you very much, Bishop Colin, in behalf of Bishop Colin, Father Tony, and our Caritas Philippines staff, sa World Health Organization, mga doctors, I salute you, and maraming salamat. Ma'am Ching, thank you, and good afternoon.
Thank you so much po. So we have have put in the chat box po yung ano natin, yung atin pong bang tawag dito, feedback form. Ano po, so baka po pwede po ninyong sagutan. We will also be sending this link to our emails that we'll be sending to you together with the video. Tuwang-tuwa talaga kami sa video. So gusto namin siyang ilabas sa lahat. So gusto namin mag-viral ang video na to. So ipapadala po natin ito sa inyong lahat together with the slides. We'll request from Ms. Ava all the slides that they've presented so that you'll have your first-hand information also to share. Now, we come to the most awaited moment of the session. We'd like to request everybody to open their camera para sa ating photo op. Syempre, hindi po pwedeng mawala ito. We have already more than 40 dioceses here. Hindi lang namin ma-account talaga lahat because some of you did not, ano bang tawag dito, didn't put your names properly doon sa ating, ano po, sa nameplates ninyo. Pareho Galaxy A20e. So, gusto sana naming malaman kung sino to because we really would like to document kung sino-sino yung mga dioceses na nakakasama natin sa lahat ng mga ginagawa po natin dito, and especially para din po mahanap natin yung iba pang mga dioceses na hindi natin nakakasama sa ating mga online gatherings. Ano po? So, ayan. Thank you so much sa inyong lahat. Okay, so we'll request muna na walang mag-chat para hindi po matatabunan yung ibang mga nasa dulo, like sina Ate Sweet, si Kuya Herman, ayan, baka matabunan ang copies. So, okay, sige po. So, ready? Smile muna po tayo, ano? We'll have 2 screens. So, unang screen muna. Okay, ready? Miss Yam, okay ka lang po? Gumagalaw yung camera. Ayan, wow, lumabas si Father, si Mr. Tagum. Biglang may tao dun sa logo nila, oh. Okay, sige po. Game na tayo, ready? Father Paking ng copies at saka si Ma'am Miriam, baka po pwede pong mag-open ng camera. Ate Zenny, Ate Sweet, Miss Alet, Eden. Oo, itong mga artista namin, oh. Huwag na kayong mahiya. Alam na ng buong mundo ang pinagagawa ninyo. So, labas na. Sige po, ready? 1, 2, 3. Okay, let's go to the next screen. Wait lang po para lang sure na hindi natin ito mawawala. Okay, sige po, let's go to the next screen. This is, wow, Father Just, nandyan ka pala ba? Kanina, hindi kita nakita. Wait lang. Okay, nakita. Siguro naman nakasama ka na dun sa nauna, di ba po?
Ako dito.
Hala, nawala ako. Okay, ayan na. Sige, ready? Second screen, 1, 2, 3, smile. Okay. Uy, salamat Kuya. Sino nga ito? Si Kuya Loy. Nakahabol ang mga taga-Sambales. Salamat po ng marami. Okay, that's it, folks. Maraming salamat po. This afternoon, sabi ni Father Clifford, yung pagpapalaganap nung ating mga information, tama ba, hindi ba to fake news, ano po, na mga nakikita natin, yun yung aalamin naman natin po mamayang hapon with Rappler. How do we fact check the information that we get over the social media most especially, but also doon sa mainstream media or sa mga kapitbahay natin. Kasi kung minsan, 'di ba, problema natin yung yung chismis. Baka may mga tayo na na hindi po pwede doon. Okay? So mamayang hapon po, 1 o'clock, we are hoping to see you again mamaya po, 1 o'clock. Again, sa ating mga kasamahan sa WHO, on behalf of Caritas Philippines and the Social Action Network, maraming salamat po, Ms. Ava, Sir June, and kina Dr. Nico at saka kay Dr. Jack. Thank you so much po sa inyong lahat. Mga sa susunod po, congratulations pala, nandito yung ibang mga bago natin ng mga social action directors. Si Father Jasper ng Puerto Princesa at saka si Father, sino nga yung bago natin from Pasig? Ayan, salamat po sa pagpunta dito. Si Father Edmond, ayan, thank you po. So, mamaya po, kain po tayo ng madami para madaming energy din mamayang hapon. And don't forget to respond to the emails that we will be sending you if you won't be able to respond to the feedback form natin ngayon po. Thank you so much. Si Ma'am Sue, sino nga, hindi ko alam kung paano i-pronounce, Suhewa. Ayan. Saang diocese po kayo, ma'am? Para po makilala din natin. Okay? Sige po. Ayaw pa ninyong umalis. Gusto pa ninyong makita ulit yung video?
Jing, we'd just like to say thank you. We were very happy to see the I Wear a Mask video, and it's really good. We were all sharing a private chat with the team, and we said that if you could share it to us, that would be something also. And well done. I hope it goes viral, not just on social media, but in actual practice. Very well done.
Correct.
Congratulations. Ang ganda, ang galing.
Thank you so
din
much.
sa pag-invite sa amin.
Yes, salamat po ng marami. Okay, dahil ayaw pa po ninyong umalis at saka gustong-gusto pa po namin i-play yung video. So, i-play pa namin ulit po. Here's the video again.
Ayaw na lang po umalis una.